Good morning, ladies. Dr. Burton here, coming to you from beautiful sunny Florida, and today we're talking about breast augmentation surgery. This is one of my favorite procedures. I love to do this procedure. It's usually done under general anesthesia. It takes about 45 minutes to do in the operating room. Following the operation, the patient will spend about another 45 minutes to an hour with us in recovery, and then they get to go home. On today's video, we're going to talk about some of the patients that I see in my practice. We're going to go over their preoperative pictures and the post-op results. With breast augmentation surgery, we see a wide range of patients seeking this operation, and I'm going to go over several of my cases today. My first case is a patient who's 20 years old. She's fit and trim. She has a beautiful smile, but for some reason she just didn't grow large breasts, and she wants larger breasts. So here on the picture you can see she has very small breasts to begin with, but otherwise she's very fit and trim. This young lady was taken to the operating room, placed supine on an operating room table. She was prepped and draped in the usual sterile fashion, and for our incision we made an incision over the lower pole of the breast. We made mirrored incisions, one over the right, one over the left, and through this incision we created a subpectoral pocket, which means we put the implants underneath the chest wall muscles. Once the implants were in place, we sat her up on the operating room table to judge for size, shape, and symmetry. And once the results that we wanted were achieved, we returned her to the supine position, or flattened her back out on the operating room table, closed the incisions, and you can see the post-op picture here. She now has nice, full, symmetric breasts. The next case is another typical patient I have in my practice. This patient is 40 years old. She has one child who's now an adult, 20 years old, and she's still fit and trim, very active. She has small breasts, and she simply wants larger breasts. This patient here, as you can see, small breasts, nice and symmetric, very good skin tone, and this patient was taken to the operating room also. And with this patient, we made an incision around the areolar complex. She also has a gel implant in place. After both implants were placed, the patient was placed in a seated position on the operating room table to judge for size, shape, and symmetry. And you can see her pre-op results and her post-op results here. You can see in the post-operative picture that she has nice, firm, symmetric, perky breasts. Our next patient is a 39-year-old female who presents wanting a revision breast operation. She had previous breast augmentation surgery done 7 years prior with saline filled implants, and these implants were placed on top of the chest wall muscle. You can see on her preoperative picture here that the implants look like they're kind of stuck on her. You see the chest wall, and then you see the implant jetting forward. And this is an implant that's placed underneath the breast gland itself, but on top of the chest wall muscle, and she didn't like this look. This patient wants to change the overall look of her breast. She also wants a slightly larger implant as well. So knowing the patient goals, we took her to the operating room and placed her supine on an operating room table. We made an inferior mammary incision utilizing her previous scar. We dissected down to the saline implants and removed the saline implants. Now she had a subglandular pocket, so we obliterated this space and created a new pocket underneath the chest wall muscle. We then placed 2 gel implants underneath the muscle. These implants were slightly larger than the saline implants that we removed. Once both gel implants were in place in the new submuscular pocket, the patient was then placed in a seated position on the operating room table, and we walked around the patient judging for size, shape, and symmetry. And again, we obtained the desired results, and following this, the breast incisions were closed. The patient was then escorted to the recovery room and spent another hour with us in recovery and was discharged home. And you can see on her post-op picture here, now she has full symmetric breasts, and she no longer has that bubble-like appearance of the subglandular implant. So you can see the submuscular implant position is a much better position for someone who's fit and trim. And the final patient I'd like to present today is a patient who comes to me wanting larger breasts. She's never had any type of breast surgery done before in the past. She's 57 years old, otherwise very healthy, very active. She has a total of 3 kids who are now totally grown, and she presents wanting simply larger breasts. We talked about the breast augmentation operation itself. We went over risk and benefits, and this patient decided to go with gel implants with a bilateral inferior areolar incision. So knowing the patient's goals, we took her to the operating room, placed her supine on the operating room table, and we made bilateral inferior areolar incisions. And through these incisions, we dissected down to the chest wall muscle and created a submuscular pocket and placed the implants in place. Once the implants were in place, the patient was placed in a seated position on the operating room table, maintaining general anesthesia. And we were able to evaluate the patient for size, shape, and symmetry. And we obtained the desired results. And you can see in the postoperative picture here, the patient now has fuller breasts. This patient was not interested in a mastopexy or breast lift procedure. She only wanted increased breast volume. And that's what we did. She now has fuller breasts. Her breasts are very symmetric, and I think the age appearance of her breast fits her age for somebody in their late 50s.